CMS has updated the CPT codes for chronic care management for 2024. In this video, we'll discuss everything you need to know so that you can properly code and bill for this program. Hey, this is JP from ThoroughCare. Here at ThoroughCare, we help groups streamline value-based care programs like CCM with our care coordination software. If you'd like a reference guide for the CCM CPT codes that we'll cover in this video, you can download one from our website. There's a link in the description below. For 2024, there were no major changes to CCM rules and regulations in CMS's Final Rule. There are updated reimbursement rates for the CPT codes, as well as an additional coding opportunity for rural health clinics or federally qualified health centers. Keep in mind that the codes are based on national averages, which may vary in your area. For the exact current rate based on your location, visit the Physician Fee Schedule website. For CCM, there are three series of codes: non-complex, complex, and physician-driven codes. These series vary depending on time spent on care management, who provides the service, as well as the complexity of the service. Keep in mind, you can only bill for one series of CCM services per patient per month. We at ThoroughCare suggest that you drop the claim with the highest reimbursement at the end of the month. Let's start with non-complex clinical staff CCM codes. The first code is 99490. It is for 20 minutes of non-face-to-face CCM services done by clinical staff. Clinical staff can be a certified nurse assistant, certified medical assistant, or higher on your staff. Current national average reimbursement is about $62. The next code is the add-on code 99439. It is an add-on code to 99490 and is for an additional 20 minutes of non-face-to-face CCM services done by clinical staff. 99439 has a national average reimbursement of $47. This code can first be billed at 40 minutes, so you'll bill code 99490 and 99439 for a total of $109 with the two codes. You can bill code 99439 up to 2 times per month, so at 40 and 60 minutes of time. At 60 minutes, you'd bill 99490 and 99439 times 2 for a total of $156. If you're a rural health clinic or federally qualified health center, you will bill a separate code, G0511. This is a general care coordination code and is the only code you can bill for CCM services. New in 2024, G0511 can now be billed for multiple instances in a calendar month. G0511 is for at least 20 minutes of non-face-to-face services. The reimbursement average for G0511 is about $72. If an additional 20 minutes of non-face-to-face services are performed for CCM, G0511 can be billed again for a total of $154 for the 40 minutes. Moving on, some patients may need more care than others, or they may need more than 2 conditions managed in a calendar month. In these cases, you'd bill using this complex series of CCM codes. First is code 99487. It is for 60 minutes of complex CCM services and pays a national average of $132 per month. There is an add-on code 99489 for 30 additional minutes of complex CCM services. Its national average reimbursement rate is $71. It's billed at 90 minutes with code 99487 for a total of $203 when billed at 90 minutes. You can bill 99489 an unlimited amount of time, so at 90, 120, and 150 minutes. Finally, the physician-driven series of codes for non-face-to-face CCM services. The first code is 99491 for 30 minutes of physician non-face-to-face CCM time and has a national average reimbursement rate of $83. There's also an add-on code, 99437, for an additional 30 minutes of physician time. 99437 has a national average reimbursement rate of $59, billed at 60 minutes with code 99491, for a total reimbursement of $142. So there you have it, the 2024 updated CPT codes for chronic care management. If you'd like to learn more about CCM, its rules and regulations, watch more videos on our channel or visit our Learning Center. There's links in the description below, and don't forget to download your free reference guide for the billing codes we have discussed in this video. Please like and subscribe. Thanks for watching.